authentic. Connected, structured, authentic, connected. I'm a good lad. Structured, authentic.
Hello, everyone. This is Mark Chubahusky, and this, believe it or not, is the 11th episode of Align Health Insights. And I have a colleague, dear friend, partner, John Warner, here with us today. So this has been a long time coming, and I'm really excited to get into this. John, say hello to the audience and tell them a little bit about yourself, sir, please.
Well, hello. Nice to see you, Mark, and thanks for having me on the podcast. I'm John Warner. I've been in healthcare, it seems, forever. In fact, I'm coming up on 30 years. I can't believe it. How did that happen? I've had the privilege of working in 3 different healthcare systems. It's one of the things I guess is notable. I started off doing a lot of work in the UK National Health System. I went to Australia for quite a long while, for 15 years, so I worked in that system. And of course, for 21 years, I've been working in this wonderful place called US Healthcare.
Yes.
Clearly the most complex beast that I've ever been involved with, but I've been having a lot of fun working in all parts of it, payer side, provider side, biotech, pharma, you name it. And trying to understand that has been one of the great challenges of life, but it's been fun at the same time.
That's awesome. And I mean, look, when I met you, you were advising a lot of companies, chairing some boards for venture firms, had your hand in just about everything, it felt like. Master networker at heart, but detailed when it comes to the subject matter. But now, like, you're actually running a company. Again, it's called CareAxis. You're leveraging AI. You're doing some care coordination stuff. Can you tell our audience a little bit more about it?
Yeah, I sure can. And, being an advisor is always interesting because you advise lots of organizations, many of which are startups, some of which are venture backed. And this started in the same place. In fact, CareAxis was a project inside an organization that hadn't gone in quite the right direction. I think the IP and the design was right, but I think the implementation didn't work out quite as well as it could have done. So we had to reimagine what the journey needed to be in order for it to not only serve that organization, but perhaps serve as something that could be a national platform. And that became the beginnings of CareAxis. Kind of being the last man standing in the room, I became the CEO for this, at least temporarily. So I'm out of my advisor role in running this, at least for a short period of time, and we'll find a good person to run it, perhaps later this year. But CareAxis, as you said, is a care coordination platform at heart. It's really a care continuity platform. Where it will start will be in the affordable housing space. It's where it's been deployed. It's a fascinating space, and I'm sure we'll get into the conversation a little bit. But what's interesting about it are 2 things I'll tell the audience. Number one, it's a space controlled by HUD, not by HHS, so it looks very different in terms of what goes on there. And what's surprising to me is not only are there 15 million people in affordable housing in America today, but there's 4.4 million seniors in that space, which on average are 79 years of age across the country and have 3 to 4 chronic conditions. So having that many people in affordable housing with no electronic health record whatsoever is somewhat problematic. And we're on a path not to build an EHR, at least not yet, but to build some of the functionality that is needed to make sure they get excellent care in the future. And that's the journey we've been on, certainly since about June of last year.
It's such an unmet need. I'm just going to riff for a minute, but I've been coming through the PA rural health transformation where the dollars are going to be allocated. And there's just a ton of money for these types of solutions.
Yes.
So I think the time is probably now, which is really cool. Yeah, with all the deep Medicare cuts, I mean, and we'll see what next year looks like. But I think some of these things are going to stick and they're really going to be able to provide value in terms of real dollars for these communities.
I agree. And it's exciting to us. I mean, we're starting this project in Ohio. We know at least half of our affordable housing units are in the rural parts of Ohio. It's hard not to believe that most of Ohio isn't rural. And so, we have some ambitions in the Rural Transformation Project, for example, to at least test that in that case. And then who's to say we can't do that in lots of other states at the same time. So that's exciting.
100%. 100%. I mean, look, just comparing to like rural health transformation for North Carolina, every state has slightly different needs, right? But I mean, they're under the guises of those needs. You still, when you really go down to it, you unsurface a lot of the same problems.
That's right. That's right. Yeah, and often they come down to care coordination, right? I mean, I think that, it's a lack
Yeah,
of continuity of care is what you're trying to solve for. And in rural situations, that's very stark because there just isn't someone around to do home health, for example. The SNF might be 20 miles away, or even the hospital in some cases. There might be a critical access hospital in a small town. But again, it's got limitations in terms of what it handles and what it's capable of handling. So all of that comes into play.
that's awesome. All right, look, so two really interesting questions on the opposite sides of this spectrum. One would be, how did you first get interested in getting into healthcare? And then the second one is, and how did your thinking evolve? Like, you've seen a lot of stuff. I thought it was 20 years, but it's 30, I guess. I mean, so that's a lot of time. I got
Yeah.
23, 24, 24.
Well, and this is why I know it's nearly 30 years, because in late 1996, and I know you know this story, Mark, but for the audience, I was sitting in the oil industry as a general manager, and I ran a refinery of all places.
Wild.
And I left that to go into management consulting work. And the happy accident for me was that I started getting, quite by accident, healthcare clients. And I got them because I had so much experience in process reengineering
Yeah.
early. And of course, hospitals in particular were a very happy hunting ground for better process. So their processes were pretty convoluted and pretty slow. This was a way of getting Six Sigma and statistical
Yeah.
process control and all of that into the mix. And I slowly became typecast. And very quickly, I ended up getting nothing but healthcare clients. So it was that happy accident. And I found it a very worthy space to be in,
Yeah.
because you're dealing with human lives and all the rest of it. The one funny thing I'll say very briefly to you is that, running a refinery, you run, about 6,000 pieces of equipment in a refinery, and
Wow.
more than that, pumps and compressors and all of these good things. And what struck me immediately was I had more data and computer systems monitoring those 6,000 pumps, compressors, and turbines than I did hospitals have on their human beings. And I thought, this is wild. I used to have a pager on my hip back in 1996 that would tell me that pump number 32147 was going to fail next week. It's a bit like knowing
Oh my
Mark's going to
goodness.
have a heart attack. I
Yeah.
did not have that for human beings, and you might argue we don't have that today. That's criminal. So that really attracted me into saying, well, why doesn't innovation and technology start to solve those problems for real in the real world and more quickly than they are? And that just sucked me in completely. And here I am 30 years later, still trying to solve that problem at scale.
Yeah, well, these problems are systemic, and they probably start with the lack of interoperability. I have a feeling, and this is, not a question that I asked to prepare you, or for you to prepare, but like the large language models, right? And we'll get into them a little bit later. So I don't, but I have a feeling there's going to be more lobby pressure for interoperability now that they're going to be dealing with so much unstructured data.
I think you're right. I think we've got a systemic problem, which is these legacy systems do go back. I know you feel it goes back even further than I do. I know Epic and Cerner were both built in the late 90s in their latest iteration
Yep,
on even earlier technology. If you go back to where they started, but
yep,
that, I can't think of a piece of tech that I'm using today. It goes back to 1998. It'd be like having a phone in my hands. It would be a brick and it wouldn't work most of the time. So why are we still doing that? So are we going to rip out that technology? It's really hard to rip it out today.
yep,
I suspect not. So I think it's going to be more layering technology. And I think
yep.
AI is going to drive that, and LLMs are going to drive that, and agents are going to drive that. And I think we're at the beginning of that era. And that's very exciting for its own reason.
For sure. So, as CEO of CareAxis, biggest operational complexities you're seeing that you're helping providers navigate.
Well, there's two sides to CareAxis, and they're both big nuts to crack. One is the hub coordination side of things. If you think about it in affordable housing, the first question you're solving for is who qualifies, who's eligible to be in it in the first place, partly because you're attracting very big government subsidies. So government is intrinsically interested in whether people are eligible to be in them in the first place. And that's a continual game. You have to go and keep doing that because your income can't be too high to even be in there in the
Yeah,
first place. And this matters. We don't want to see lots of churn, and you can't run a business that way, and individuals get messed around quite a lot in so doing. So we're building the technology to make that much easier to do, use electronic systems to do it, not use spreadsheets and Word documents and sticky notes to understand where that might be going south, or going well for that matter. On the other side, it's the very thing I alluded to earlier on in the conversation. We've got 4.4 million people who are on average of 79 years of age. And for the most part, the one place they're going is to the emergency department. And when they turn up, there's no packet of data that says who that person is, or indeed, is it safe for them to return home if it's a relatively minor issue? We're solving for that as well. In as much as we're saying, let's understand the human being that's in affordable housing at a very individual level, including all the social determinants that may well say whether they thrive or not. We're solving for that at the same time and making sure that everyone in the care continuity system understands the transitions that they will be making in their life, particularly in the last 20 years of living. When they may need medical care or may need, drugs or whatever it might be to go and deal with the chronic conditions they've got. That's what we're building, and that's a big plate of stuff to build.
I forget the statistic. I think it's like 85% of all of your healthcare costs you incur in the last 5 years of your life.
Yeah, it's absolutely huge. And we're doing this in individuals who are largely duals. They're Medicare and Medicaid on the senior side of things. And yeah, these are big costs that the medical system, CMS incurs, the government incurs. This is taxpayer dollars. So if we can make it wiser, we can actually get the triple win, right? We can get something good for the patient, which is where you should start in this case, but also for the provider so they can run a business that's, profitable for them and for them, the underwriting payers, whether they're the government or commercial payers. If we can do that, that'll be fairly unique in healthcare.
Yeah, for sure. It's an unmet need, big unmet need. Okay, switching gears, there's a young CEO out there facing a pivotal decision of some sort, right? What would you tell him?
For me, the answer to that question is always context. I think decisions don't live inside a single issue. There's always, a lot of externalities. So I think when something looks like a big decision, a pivotal decision, I think in what context do we go left or right or choose option A or B or C is what drives the right outcome, right in inverted commas here, of course. So I think what I'd say to them is don't get drawn into what looks like the most pressing way to go and even make it a binary decision. We can go left or right at this fork in the road. I think context actually provides much more color and sometimes show you there's not only more routes to take, but that there are things you haven't even thought about. So I think that's a consultation game. It's using your team, in intelligent ways. And that's what I've tried to do throughout my career, wherever I've been. And it's what I do in my advisory role as much as I'm able.
Yeah. I think like there's two things. I think there is humility, right? In the way that you have to listen to your advisors and you have to listen to the people around you. Take what you need to. You don't have to take all of it. And then also the communication aspect, right? It's like, look, we are going to try this, right? But it's like that real time communication of what's working and what's not working so that you can jointly make a decision to pivot quickly again.
Yeah.
Because look, at the end of the day, you have to make decisions because you have to linearize the unlinearizable, so to speak, right? But you have to be willing also to say, okay, this didn't work, and how much more, investment cost do we want to sink into it?
That's right. The famous pivot, as it were. Yes, I've always liked the Latin derivation of the word decision. What decision do I make right now? Which is what you're alluding to. It's decidere, and decidere, to go back to the original Latin, is to cut. So in the end, what a decision making comes down to, it's what do I cut out of my possible options going forward? But have I done it sensibly? And I think that's the great leadership challenge of almost anywhere, and it's certainly true in
Yeah,
health where lives matter.
for sure. For sure. Okay. So look, with AI playing this growing role in healthcare, how do you see tools like ChatGPT and Anthropic and Claude for healthcare impacting providers and patients in the near term?
So I'm a super optimist when it comes to AI, and I know we have all sorts of regulatory issues that need to play catch up with all of this, and perhaps the genie's out of the bottle, and who knows whether we'll get the right regulatory framework. But I think the technology is evolving wonderfully well, and I think the possibilities are really fantastic. I split them really into the things we can do now and the things we should do safely, perhaps tomorrow, whenever tomorrow is, whether it's 6 months or a year or a little longer down the road. But we can do so much now. We should focus our time and attention. You alluded to the biggest of those, which for me is we can harness finally some of the data that we know is sitting around in lots of pockets and places, whether it's structured or unstructured. I think it's a wonderful chance to tidy that up. Whether it's episodic data or whether it's trend data, which starts to get us into things like predictive analytics. I think that's incredibly exciting, and I'm seeing many, many, many wonderful technologies getting born almost in a heartbeat. Companies that are 6 months, 9 months, 18 months old. I look at, say, Open Evidence, for example.
But yeah, $12 billion valuation.
Patient dead. I mean, it's just incredible. We can harness so much information and concatenate it so well using AI scraping tools to go and enable that process.
Yeah. Like I think the models are there. Again, when we look at like Be Well Connected and its role within OpenAI, that's where like all the messy stuff is. Really all where the majority of the problems are lying. It seems like.
Yes, I think that's right.
Well, yeah. I mean, look. At the end of the day, what it's 40 million queries a day are health related to ChatGPT. 5% of all global queries. So, I mean, we're also looking at a world where patient engagement numbers on like things like digital front doors are, you know, 5%, uptake.
Or
So a
less.
lot or less, right? So could it be the day, John, that we see? Are we in the days of patient engagement adoption? You think? Are we there?
I think we're now walking towards it for the first time for real now. And I think the promise was always consumer health. And I think there are always people at the edge willing to experiment with that. And we've seen certainly private pay increase in recent times, which
Yeah,
shows people want that more control over their own health and their own capacity to thrive. I think these tools allow that to happen. Of course, on the other side of that coin, we've got to make sure that it's safe for them to do so. So it's one
yeah,
thing. I mean, Dr. Google was always alive and well, but then how credible was that data, whatever we did with
yeah,
it? And AI faces the same problem to some degree.
yeah.
So I think we've got to go and pursue the parallel path as we do it. But I do think we'll see consumer health strengthen considerably in the next 3 to 5 years for sure.
Yeah, I do too. I really do. I think it's one of the more exciting times. I feel like in the next decade, we're going to see more change in the US healthcare system than we saw in the last three. How about you?
Yes. Yeah,
Yeah,
I agree with that. And I think the only caveat is that the regulatory scene has always been problematic and
for sure.
legislation doesn't keep up, very well. And some of that's at state level and some of that's at federal level. I think that remains a challenge for us. So I think that's one thing we need to think about. We'll need new legislation to enable what we want to do with the right safeguards and so on in the mix. And we've seen the different approach that, say, the US has taken versus the European model for this. Perhaps you can say the European model's overcautious, ours is perhaps a little overly gung ho. I think there's a middle ground there. So
Yeah, I mean, well, look, I mean, if you just think about like privacy protection and GDPR, which informs CCPA, which is now informing every other state. So it's not like we're, I think, as well. I guess we are more risk averse, but we seem to be following suit.
yes, I think so. Well, I think we're borrowing from each other actually, and I think that's a good thing. I think the world could do well to collaborate more on these big, ambitious projects that we're pursuing right now.
Yeah. So looking ahead, putting on your crystal ball and your prediction hat, what is going to be the biggest disruptor in the healthcare industry over the next 5 years?
The obvious answer to that, as we've already alluded, would be
Yeah.
AI to change the world, and who could argue with that? However, I think what I'm most excited about from a technology perspective is data. I
Yeah.
think in the end, all decisions in life, start in the frontal lobe somewhere. We're paying attention. Are we pay attention to the right data? And then what can we do with it? And I think the capacity for predictive pathways for people, digital twins is a very good example of this
Yeah.
technology. We've been talking about digital twins for 25 years without it really manifesting itself in any real way. I think we're going to have the capacity to do so. I think that'll end up in the consumer's hands in the future, and we'll literally be able to say, if you smoke and you carry on smoking for the next 5 years, here's what your digital twin's going to look like.
Yeah.
We're going to see that, very quickly come to bear. So I'm really excited by that, and I think we'll be able to clean up a lot of the data, the duplicative data, the wrong data. Now we're not there quite yet, but I think the tools are in place, and that's what gets me most excited because I think AI can really help with that and
Yeah.
power it along.
Yeah, for sure. So in 2026, like just looking more near term, what are you most excited about when it comes to digital health and telemedicine?
I think in the end, it's probably our chance to go and pull tools together in the digital health sphere that solve real world problems. I think we've had a long period. I mean, it wasn't that long ago we were talking about mobile health. Health is a very fresh thing. And I think we built point solutions galore. I mean, there's literally tens of thousands of apps.
Oh, yeah.
I mean, arguably hundreds of thousands of apps, many of which, die their own personal death or just live out there and sort of, deal with very narrow problems in very small numbers of patients. I think that's going to change. I think we're going to see it coming together. So whole classes of technology, I think, are going to get boosted by this. So at the app level, in the realm of telehealth and virtual care in particular. And I think when I talk about real world problems, I'm thinking about, for example, the promise of health at home or hospital at home. I
Yeah.
think we're on the verge of being able to really implement that. so that we can have individuals who do go to the ER, for example, and instead of going into a SNF environment, we'll be able to go and say, no, they can capably thrive at home, and we
Oh,
can
yeah.
coordinate the care that they need, and we can supply the equipment they need in order to support them with that recovery journey to get back to stasis in some way. That's what excites me about the capacity to stitch digital health together for the first time in a way we haven't done in perhaps the last 15 years or so.
Yeah. My last podcast guest was Zolt Kolchar, the VP of Digital for Emory, and he was saying pretty much the same things.
Yeah.
I,
Yeah.
I tend to agree with you. So there's all these policy changes happening. Examples: Medicaid cutbacks that are affecting healthcare organizations. What strategies do you advise some of these companies for, resilience?
Yeah, I think my basic strategy here is pay attention to everything going on. I mean, governments come and they go, and of course, we go different sides of politics have got different ambitions and priorities in terms of what they do. But I think at the core, I think we're pursuing a number of things that are just trying to make this better for all. It's those same three stakeholders. It's who pays for this, who provides the care in the first place, and who's the recipient of care. We've got to look at policies that try and balance all of those. I think both sides of politics supports that in the broad. So as I look at the T model, I look at LEAD, I look at the access model now, role transformation you
Yeah.
mentioned. I think these are all worth looking at and seeing, can you play under the current rules or can't you play? In the end, we have to run businesses and we have to run them profitably. So I think that's the lens through which I look at it. But regulation's necessary. You can't ignore it. So I'd pay attention, and I wouldn't line up politically in any way. I think if we've got CMMI putting these programs in place, how can I win under the aegis of that plan? Should be the question you're asking yourself, and the answer might be yes or no, but at least approach it with an open mind would be my advice.
Yeah. I mean, I advise some companies, and regardless of the political climate, I don't think the inherent need changes, right? You just have to be more nimble in the way that, okay, so if there's not enough Medicare dollars there, maybe you're just going out heavy on business development and finding some clients that they find value in what you're
That's
doing.
right.
And
That's right.
ultimately, either way, the policy environment, the wind will blow one way or another. You just have to be positioned and adjust accordingly.
I think that's right. And I think the key word in all of that is, risk mitigation. I think that's what we're doing in healthcare. I think we're thinking
Yeah,
about risk at a personal level for us. If I eat a bunch of donuts, will I go and develop problems down the
it's
road?
true, right?
Same for the provider. They're thinking, can I take this patient on? Do I understand who they are, what risk it presents to me? And at the payer level, the same thing. They're thinking, what risk am I trying to underwrite here so that, the premiums cover the cost that I'm going to have a year later or whatever it might be. So we should be managing risk. And again, I think we've got the tools of AI today to understand that at a much more sophisticated level than we've ever had.
Yeah, I mean, I think we kind of alluded to this, but your take on the balance between innovation and regulatory compliance. Example, based on recent FDA clearances and policy shifts.
Yeah.
What's your thoughts there?
I mean, this is fairly obvious as an answer, but it's a balancing act. I think regulation is necessary, as I said earlier on, and I think you've got to pay attention. I think one of the things I say to startups that I advise is read the legislation. I see too many people trying to summarize it or shortcut their understanding, or they just trust a piece of advice they've got from perhaps ChatGPT. It's not enough. You need to understand how to navigate those rules not only today, but as they might change tomorrow. But at the same time, I think we've got to sometimes, go forward and break things. And I think innovation is a balancing act at the end of the day. And we've just got to make sure we interpolate between those two things. FDA approval is a very good one. I mean, when we talk about drug development, which is a long-term game, if you can't play that game well, you're not going to win. You've got to find the balance in some way, shape, or form. So as obvious as that sounds, that's what every startup founder has to do.
Yeah, I just want to take a broad swipe at the investment landscape really quickly. We'll stay away from public companies right now, which seem to be shedding more than hiring. Really focused on the bottom line, really leveraging AI for a lot of the operational stuff, right? But the PE firms and the venture firms, historically, PE has had far better consistent returns in healthcare, although people argue that it's making healthcare more costly. And venture really has had relatively disappointing terms to balance returns rather. To balance that, though, it seems like we're really in that risk on and ventures doing well. Kind of era. But then the last question, and I know this is a lot, but it's like there's also people saying venture is dead, but I'm not seeing that right now. So, just unpack a little bit about each sector: PE, bootstrap venture?
Yeah, no, I operate also in the investment space, Mark, and it's hard to go and give a short answer to this. I'm not fond of, huge sweeping generalizations about people
Yeah,
talk about VC
me
as if it's
neither.
one thing, and it's not one thing. And it depends,
It's not.
at the level at which you invest. I mean, obviously things that sort of pre-seed and seed and even A round are very different to when you're doing a B or a C, etc. Private equity tends to come in later. It depends on the measures you're then using. It's part and parcel of that. They all vary, measuring ARR versus, getting a return on investment, for example, at a very straight line EBITDA level. I think we're going to see a roller coaster, and I think AI is at fault here somewhat. I think the potential for
Yeah,
AI is throwing everybody off, but it will settle down. So my net bottom line on all of this is I think you're going to see venture alive and well. You're going to see private equity alive and well. You'll see corporate venture actually start to grow up, I think, in this era and know where it should
yeah,
invest dollars. And I think family offices come into the party now with
for
more
sure.
aplomb
Seeing
than they
that.
had a decade ago. So I'm very excited about the investment space. I just think it's a little discombobulating because AI has kind of thrown a great big rock into the pool. That's no
Yeah,
bad thing.
yeah, yeah. I think just to oversimplify it, if we're looking at AI and healthcare, $471 billion writ large goes across every vertical. By the way, the returns, if you need to create like $1 trillion worth of revenue to make that return on invested capital meaningful. We're not near there, but I think we will get there. Um, I think there's 151 use cases across healthcare and life sciences for automation, right? Some have more pull from the market than others. I think there's four probabilistic outcomes. I think a very narrow 2% file an S1, right? I think the use cases that meet the execution and sales risk, right, that have a lot of pull from the market for their use case may go 10x plus, on an exit. And then the third and most probabilistic for me, I think, is going to be a roll up of a lot of these assets to make more comprehensive solutions at a 3 to 4x multiple, and then the rest might go die on the vine. That's my
Yeah.
take.
Yeah, that's not a bad take. I think the other issue is, we both know there's a lot of problems that go unsolved completely in healthcare, where there's
Yeah,
not a lot of red ocean space with people competing to go and put the latest platform together or app or whatever it might be. They get me excited as well. And if you can live with, a 3x, 4x, 5x return, there's good money to be made out there and there's
for sure.
lives to be changed for the better. So I'm very excited about that as well. We don't all have to be the unicorn company.
Nope.
There's room for a few of those, but most of the success is going to come in the middle of the market, not at the.
Just thinking about this though, and I want to get your take. It's like we started really talking about 5 years ago, and I remember just in like that time of 2022, and it was the time from like growth at all costs to capital efficiency at all costs based on, the major shift in market conditions. I have to say today, right, I'm seeing a lot more real companies with real business models than I did then.
Yeah, I go two ways on that. I mean, at one level, I will go along with you that I'm encouraged. I went to health this last time and I'm going to Vive this year again. And I've seen all of that sort of AI driven stuff disappear by and large because it wasn't
Yeah,
real a year ago. So I think at
yeah,
one level, I think things are settling down. I think on the other hand, I think we've still got some settling down to do.
for
I'm
sure.
still seeing individual companies that have started 6, 9, 12 months ago that are getting $50 million.
Yeah,
But something that's sitting on top of, Claude or ChatGPT, again, as
for
you
sure.
alluded earlier. And it's not just in healthcare, it's everywhere else, right? So, and if you look, someone like a Lovable, for example, as a vibe coding tool, 80% of its costs, its costs are being paid to Anthropic. Is that a
Yeah.
real business in the long
Mm,
sustainable term? Well, there's a lot of
I
work
don't
to do
think.
in order for it to stand alone. And I think that's what we have to worry about a little bit in the short term.
Yeah, I think that's really spot on and a really great insight. Okay, so from quick professional advice to multi-year retained support, how do you tailor your advisory services to meet the need of early stage startups versus like big established multinationals?
So my world's a kind of an interesting one. I only have so much bandwidth to advise,
Yeah,
right? By the time I get to sort of 5 or 6 companies that I'm working with, my bandwidth is shot completely. I'm probably doing a 50 or 60 hour week at that point.
too much.
So things don't drop off that often. And I'm actually these days, because of all the gray hair on the head I've got these days, I'm able to choose a little bit.
It's
And
good.
that's nice because I can work with companies I think are well run. I like the founders. I like the problem they're trying to solve. So by and large, my advisory these days is sort of very slow. Something rolls off, something runs on. That might only happen once in a year. So
Yeah.
that's the simple answer to that question. But I do like early stage. I lean towards early stage. So for me, companies that are looking for a seed or an A round, maybe a B is where I like it, because there's more
Yeah.
chance of influence in that environment. It gets very institutional once people have raised a B or a C. So I avoid that generally.
Well, when you got two excited guys that talk fast, I'm pretty much out of questions. But I have one more question for you. Outside of work, I want to know, like, what do you do to recharge, re-energize, and fill your spirit so that you can come and attack healthcare problems with, this insane vigor and enthusiasm that you generally have every time I see you?
So I'm a massive reader. I'm a huge podcast listener.
I
So
know
I'm
that.
afraid
I know you are.
the workaholism continues in. So I listen to absolutely everything. I love ideas. I love them coming from other sectors, not just within
Yep.
healthcare, because I think that's where we learn best. So I think those are the things that I probably spend most time doing. I'm also these days a pretty avid tennis player, so my way of
Cool.
relaxing
I
is to
play.
go and try and hit the ball hard at my advanced years, which is getting increasingly difficult, by the way. So that's what I do with my spare time. And by the way, I'm playing myself with a fair bit of AI at the moment. So I'm making my own foray into the world of Claude and Gemini and ChatGPT. And I'm doing that in the investment space, and that's been
I
a
happen
fascinating
to.
journey.
I didn't know that we were going to talk. I think maybe we have to reserve another half hour to talk about what I know you're saying, and I think that's really super interesting. I won't mention another word.
It's been fascinating, and the story is going to continue. So yes, we're due an update in any case. So yes, another half hour would be great.
That's fantastic. Well, look, thank you so much for joining me. I have been wanting to ask you for a while. I'm glad we get to keep in touch, but I think that I really wanted to kind of share some of this with my audience. So thanks, John. I really appreciate you joining. Everyone, this is Align Health Insights, episode 11 with the John Warner. Thank you.
Thank you, Mark.